Hi guys, good afternoon. I'm starting the new unit, unit 2, and we will start from chapter 6, which is bones and skeletal tissue. In this chapter, I will be going over everything about the bones, the histology and the gross anatomy of the bones and some related disorders. So the chapter outline is the basic function of the bones. We'll start with the basic function, then classification of bones based on their size and shape. Then when we take a piece of or a bone in your hand and you see from outside without any microscope or any aid with your naked eye, then that is called gross anatomy. So we will talk about the gross feature of the bones, and then we will dissect it, see under microscope, and what is the histology, microscopic structure of the bone. We're going to talk about that. And when you study microscopic structure of bone, bones are made up of a small unit of bone that is called osteon, O-S-T-E-O-N, and you will see that. Okay, we will talk about osteon. Then bone development and growth. We have two kinds of bones in the body. Some of them are like long, some of them are flat, and these two kinds of bones develop from different process. So we're gonna talk about development and growth of the bone. That is called osteogenesis. And then if you see bones surface is smooth, there is and there is modeled. So how bone is remodeled, how its shape is maintained, how its growth is maintained at a rate. We will talk about that, and then we'll talk about some disorders of bone. Okay. So let's start with the overview of the bone structure here. So here in the right side, you can see the diagram. We have a bone. This is a long bone. You can see the middle part of the bone is called diaphysis, the middle piece, and it has two ends that is called epiphysis. The proximal, the end which is towards your head of any bone is called proximal epiphysis, and which is towards your toe, that is called distal epiphysis. Okay. Now, each epiphysis, the epiphysis is connected to diaphysis through epiphyseous line, and that shows this epiphysis part of the bone grows from different source, whereas diaphysis grows from different source. Okay. Now, when you give a longitudinal section of the bone, you can see some part of the bone is hard, which is outside. You see, that is called compact bone. You can see here the hard part, compact bone. And if you see middle of the bone, particularly in the epiphysis region, then you're gonna see a spongy bone. In the diaphysis center, there is a cavity that is called medullary cavity, and that contains yellow marrow. This area contains red marrow. To supply energy, nutrition, hormone, and all chemical compounds, particularly the electrolytes, the bone, if you see any bone, there will be several holes in the bone, and those holes are called nutrient foramen, and through the nutrient foramen, artery enters inside to supply nutrition and oxygen. Okay. The outermost layer of connective tissue lying over the hard bone, which is called compact bone, is called the periosteum, and periosteum is attached to the hard part through the perforating fibers. Okay. The artery or blood vessel which enters through the nutrient foramen is called nutrient vessels. Okay. So these are the gross structure of the bone. Okay. Inner side, if you take out all the yellow marrow, the inner wall of the bone of the compact bone is also covered by a connective tissue layer, and that is called endosteum. Okay. So here, a bone is an organ or a tissue. So bone is an organ made up of bone tissue, and several other kind of tissues. Okay, so bone contains several types of tissues, but it is dominated by bone tissue, which is a type of connective tissue. Contains nervous tissue, blood vessels. It also contains cartilage. You can see the end of the bone is called cartilage. This is articular cartilage, and they are made up of hyaline cartilage, and it is called articular cartilage because this either end, whether it is proximal or distal epiphysis, it articulates with the other bone to make a joint. Okay. Main function of the bones are support, means it provides a hard framework for your body. Like when you build the house, first you see the framework without any brick or anything, any cement, any covering. So bone is that way. It is like a framework for our body. Bone attach skeletal muscles. That's why it is a levers for our movement. Bone protects several vital organs in the body, like the skull bone protects your brain, thoracic cavity protects your lungs and heart, and bone also store the minerals, most importantly, calcium and phosphate. That's why, because these calcium and phosphate, these bone, the minerals you need all the time in your body for function properly. Okay, so to let's see, your every cell needs calcium, uh, phosphate for function. Neurons needs calcium or other compound for function. And when there is lack of calcium in your blood, in your other body part, it is bone which release calcium. That's why it is storage. Blood cells, all your red blood cell, white blood cells are formed in your bone marrow, particularly the red bone marrow. As I said earlier, the end of the bone contains red marrow. That is the part which contains the site for red blood cell formation. Okay, not the yellow part. A classification of bones based on the length and width of the bones. Bones can be long bones, short bones if they are cube shaped, flat bones if they are thin and flattened, irregular bones if they do not fit into these all three classes. And you have some examples here. So you can see here, this is the humerus, the arm bone, that is called, this is a long bone. You can see their length is bigger than their width. This area here, you can see the radius and ulna. These all are long bones. Then let's go to B, short and bones. Short bones are the bones in the wrist. You see, there are 8 bones, and those are the short bones. For example, triquetral is one of the bone. Okay. Then see flat bones like your ribs. Your ribs, your skull bones, they are flat bones. Your sternum, they are the flat bones. Okay. And if you see the vertebra does not fit anywhere, so that is considered as the irregular bone. And you can see only lateral view. If you see anterior view, you don't see these processes. Okay, now gross anatomy. So to see gross anatomy, we're gonna take a bone in the hand and see it. And then you're gonna cut through the middle, longitudinal as well as transverse, and then you're gonna see bone. So as you know from the very first slide, bone has outer part, which is called compact. It has inner part that is called spongy, and both ends are called epiphysis and middle end is called diaphysis. Keep in mind, and we will start from there. So compact bone is made up of a dense outer layer of bone. It is dense, strongest part of the bone. And this compact bone is made up of the small unit of the bones, and that is called osteon. And we're going to talk about osteon. So osteon is the small units of compact bone. Compact bone means hard bone. Okay. Whereas a spongy or cancellous bone is internal network of bone, which is found in the epiphysis area mostly. Okay, so structure of a typical long bone, you have a diaphysis, epiphysis, blood vessel, medullary cavity, membranes, periosteum, perforating fiber or surface fiber. We talked about it, but I'm going to go again. So let's see, this is the long bone here. It has the proximal epiphysis, diaphysis, and distal epiphysis. And this greenish blue bluish color is sky blue, is the distal epiphysis covered by hyaline cartilage. You can see here also hyaline cartilage. So you can see here A and C. This is A, B, and C. So A is whole long bone. Here you have a transverse section of the bone a little bit. And here is another. This is the transverse section in the spongy region, and here is transverse section in the compact region of the bone. So you can see here both. Okay. So in the epiphyseous region, you see there is articular cartilage, this blue thing. Then you have a very little compact bone, and then you have a spongy bone. And then nutrient artery are entering through the nutrient foramen. You can see that, which is not showing here. Okay. Usually they are in the shaft. But when you come here, in the longitudinal section, so let's go from outside in the compact bone here now. The outermost connective tissue layer is called periosteum, which is attached to this compact bone through a fiber that is called sharp piece fiber or perforating fibers. And then when you take out all the yellow marrow from the medullary the cavity, that cavity is called medullary cavity. And you see the lining membrane here, that lining membrane is called endosteum. And then nutrient vessels are entering through the nutrient foramen to supply blood vessel to the compact bone. And you can see when artery enters, some goes all the way in the longitudinal fashion, and then some goes transverse, and we're going to talk about that later. Okay. Now, if you magnify here in the compact bone, you can see several units. You see the holes. Each hole is the one unit of bone, which is called periosteum, and we're going to talk about it later. Okay. That is long bone. Now let's talk about the short, irregular, and flat bones. They are not that way. They don't have epiphysis and diaphysis. They have their structure. They are like diploid. They are like it's like a taco. Both sides you have a taco, and then you have meat inside here. So it's like taco. Spongy is meat, and the wall compact bone is the taco. You don't have medullary cavity. And that's why there is a lot of spongy bone, and that's why this kind of irregular, flat, short bones makes a lot of red blood cells, not the long bones. Long bones have very minimum role in red blood cell formation. Most of the bones which forms your red blood cells are these bones. Okay. Plied bones, short bones, and irregular bones contain bone marrow, but no marrow cavity. They have bone marrow here, but no cavity. Internal spongy bone of flat bones are here. That is called diploid. Okay. And if you see any long bone or flat bone or irregular bone, none of the bone's surface is smooth. There is always some bump, some depression, some irregular surface, some hole in it. Some holes are passing through all the way. Some holes are only a deep little bit. And those are called bone markings. Okay. So superior surface of bones reflect stress on them. So why those are the bone markings? Let me tell you one thing. Our bones develop from hyaline cartilage. So when you are 8 weeks intrauterine life in your mother's womb, that time your hyaline cartilage slowly turn into the bone. And at the end of the bones, on the epiphysis end, those hyaline cartilage remains there. And slowly we develop muscles on the bones. And then muscle contract when you are in the fetus. Or like the 6 months, 7 months, 8 months baby will be playing like a baby outside. They will be contracting, playing, moving their body by contracting those muscles. So when those muscles contract, they pull some of the bone, and that makes the irregular bone markings. Okay, some artery interns and they make nutrient foramen. Some holes are developed. Okay, so these superficial surface of bone reflect stress on them due to muscle and other flexion. There are three broad categories of bone markings. We call them projection. They are for muscle attachment, and surface of the bone end are for the joints, and depression and openings are for the articulation, or openings are for the entry of other muscles or artery or vein or nerve. Okay. Here are some of the examples like tuberosity, trochanter, line, tubercle, epicondyle spine. These all are the bone markings. You can see, and their definitions are here. Okay. Let's talk about the microscopic structure of the compact bone. This is the most important for your exam purpose. You can get like exactly this diagram, and you may be asked this for the lab portion, because we do in the lab too. Okay, so VVI, very, very important, this slide. Okay, so we have A, B, and C here. Can you see that? Okay, so here, A, you have a long bone here, and we are taking a chunk from the compact bone of the diaphysis here, and then we are magnifying it. And so from here, everything is this compact bone. Are you following me? And I told you earlier, in this compact bone, these compact bones are made up of the unit of bones, and that is called osteon. You see here, osteon? So what are the osteon? You see, this is one osteon. Here is another osteon. Here is another osteon. And outside the osteon, there is layer of the matrix, which is called lamella, and it is in the circumference of the bone around. So we call them circumferential lamella. Very important here. So osteon, again, osteon is the unit, a small unit of compact bone. They are made up of a small unit, like our body is made up of small unit called cells. Bone is made up of a small unit called osteon. Clear? Okay, so now if we understand one osteon, we can understand the whole composition of compact bone. So let's talk about what exactly is osteon. Okay, so osteon has in the center, you see the red, the cavity, you see the hole here, the hole here, which is containing the blood vessel. So each osteon has central canal, means cavity in the center, central canal. Around the central canal, if you see, there is, let's see, I'm taking one chunk from the wall here and then magnifying in the B. So you see there is one layer of matrix, another layer of matrix, another layer of matrix, another layer of matrix, and then you have central canal here, the central canal. Okay. So bone is a connective tissue, and connective tissue contains cells. Cells are very separate, and those cells then produce matrix, and that is called connective tissue. And matrix has a lot of fibers, if you remember connective tissue. That's why in biology, particularly human anatomy and physiology, whatever you learned in the previous unit or lecture, it's gonna be used and applied in next section. So study better. We remember them forever, okay? So now here, this is lamella. So you see there, between the lamella, there are the cavity. Those cavities called lacuna, you see? The space is called lacuna. Inside the lacuna, the blue dot is the nucleus of the osteocyte, the bone cells. Osteocytes are the bone cells. So these bone cells mix the matrix around themselves, first around the central canal, then here and then here. And if you see here, they are in circle around each. And then some of them put outside in the circumferential lamella. So osteon contains central canal, And around the central canal, there is a layer, circle of ring of layer of matrix. What is that called? Lamella. Singular is lamella, plural is lamellae. Inside, in between the lamella, what do you contain? There is a cavity. What is that cavity contains? That is, what is that cavity called? That is called lacuna. What lies in the lacuna? The adult bone cells which produce matrix or lamella. That is called osteocyte. Now, if you see here, artery is only in the central canal. And in the central canal, there is not only artery. In this diagram, you can see only artery, but it also contains like veins, lymphatic vessels, the nerve fibers, everything is there, okay? So our blood is here. Blood vessel is here. So how nutrition reach here? You see the small channel, through that nutrition come to this cell. From there, it comes to this. From there, it comes. So what is this connecting channel called? When it connects from one lacuna to the another lacuna, that is called canaliculus and canaliculus. Sorry, osteocyte. And why I'm writing wrong spelling? Osteocyte. Then canaliculus, singular, canaliculi, plural. Okay. So these all are the structure in every osteon here. Okay, so this is the diagram. Now, if you see the cartilage, in the cartilage will be similar cavity here. And there will be matrix. But the cartilage cell will be not the osteocyte. That will be chondrocytes. When bone developed, these cells are young and called osteoblast. But when they mature, they are trapped inside their own matrix. And we call them osteocyte. Okay. So like if you go and you see medullary cavity was lined with endosteum, and central canal also is lined with endosteum. Okay. So if we see under microscope, this is structure, how they look. You see, here is one osteon. You see, it's central canal. This central canal contains artery, vein, nerve, lymphatic vessels. Then around it, there is circle. You see, each circle is called lamella. Then you see the dark cavity. That cavity is called lacuna. Inside the lacuna, you have nucleus of the cell. That cell is called osteocyte. Okay. And then you see the small lining, those are the canaliculus. So between the osteon, like here, between this, and this three osteon, there is some layer of matrix, and those are called interstitial lamella. So there are three types of lamella. The lamella which is in between the osteon is called interstitial. The lamella which is encircling around the central canal is called concentric lamella. And the lamella which is outside the osteon around the periosteum is called circumferential lamella. And periosteum is attached to the compact bone by the perforating fibers, or we also call them somebody's name, Sharpie's fiber. Okay. This is the histology of the compact bone or hard bone. Chemical composition of bone. So let's see if I put a bone and grind it and find the composition. What are we going to find? Most of the bone is a living tissue. Yes, bone is a living tissue. So if it is fresh bone, It is a living tissue because it has blood vessel. So if it is a living tissue, then it will have a lot of organic and inorganic components. So 35% are organic components, like composed cells of cells. Which are the cells? Cells are osteocytes, fibers, collagen fibers, or any organic substance. Organic substance are like protein, glycoprotein, carbohydrate, collagen, and other fibers, which is protein fibers. Then there is a bone is different from other connective tissue. None of the other connective tissue has inorganic component a lot, like bone and organized. To make bone harder, you have inorganic component that is called inorganic mineral salts, and they are primarily calcium phosphate, calcium and phosphate, and this resist compression. So organic component, this gives the flexibility to the bone, whereas the inorganic gives the compression to resistance to the compression. So let me ask you one question then. If I take a piece of the chicken leg, whole chicken leg, and put into oven for 10 minutes and then take it out, what will happen? Bone will be normal, healthy, or it will be very spongy, like easily malleable, or it will be very brittle. So when you are putting in oven, what you are doing, what you are killing the organic material. You are killing all the cells, fibers. So what remains then? Only inorganic component. What does inorganic component do? They give the hardness. So bone will be very hard and brittle. It can be harder, but it will be break easily because it has no flexibility. Let's say another situation. If I take a bone, same bone, normal bone, and put into the acetic acid for 24 hours, what will acetic acid do? Acetic acid will leach out all the inorganic mineral salt. That means calcium and phosphate. So now bone will have all organic component. Flexibility will be a lot there, but the strength will be gone. So you can bend like a rubber, that bone. That is the chemical composition of bone. Okay, development of bone or bone development, that process is called ossification or osteogenesis. Bone tissue can be formed in two ways. One is called, they are formed in the bone, in the membrane, or they can be formed in the hyaline cartilage. So if they are formed in the membrane, then we call them intramembranous ossification. In this case, bone directly come from mesenchyme. You know, connective tissue come from mesenchyme, and this kind of membranous bone come directly from mesenchyme. So they are more near to the other connective tissue compared to bone. Other bones develop initially from hyaline cartilage, and chondro is the adjective for the cartilage. That's why we call them endochondral ossification. That means they are formed in the hyaline cartilage. Okay. So two ways of bone development, ossification: intramembranous ossification and endochondral ossification. Let's go on both of them. So first, intramembranous ossification. There is very few bones which are formed by intramembranous ossification. Those bones are like your skull bones, flat bones, the ribs, sternum. Those bones are the flat bones, and they are formed by intramembranous ossification. So as you heard earlier, intramembranous ossification start from the mesenchymal cells. So in your fetal life, at the beginning, around the fetal body part, they mesenchymal cells, or this is the totipotential cells, move from the growing fetus, and they start these cells, spindle shape. They start making these mesenchymal cells, then transform into the bone forming cells. We call them osteoblast, or the baby bone cells. After a certain time, when they get mature, these osteoblasts start making these dots like extracellular matrix, and that is called osteoid. These also forms a lot of collagen fibers, these cells, you see. So at the beginning, what happens? Number one, an ossification center appears in the fibrous connective tissue membrane. So there is like fibrous connective tissue, this, and then this ossification center develops, and that comes from mesenchymal cells. Selected centrally located mesenchymal cells cluster and differentiate into osteoblasts. You see, they change into osteoblasts, forming an ossification center. So it is like a center for ossification bone formation. Later, then what happens? You see, as I told you earlier, these osteoid thicken up and they surround their own osteoblasts and become the osteocyte now. And some of the osteoblasts start moving outside, making the newly calcified bone matrix. Then calcium phosphate comes and magnify them. Blood brings that. Bone matrix osteoids secreted within the fibrous membrane. Osteoblasts begin to secrete osteoids, which is marginalized within few days, and trapped osteoblasts become osteocyte in their own matrix, okay? Slowly, you see bone cells are already matrix here, trapped here. So now, to provide nutrition from nearby blood vessel in the fetus, migrate and start growing. So trabeculae of oven bones start, oven bone and blood vessel start here. They start making periosteum, and then oven bone and periosteum form that way, okay? Then later, on the outside of the bone, you have the plate of some of the mesenchymal cells start making the fibrous connective tissue, which becomes periosteum, okay? And then you have compact bone, osteoblasts are on the side, which are adding bone and keeping the shape of the bones. This is called intramembranous ossification. Whereas endochondral ossification is for long bones, and you're going to see here now. So endochondral ossification, endochondral bone formation means bone is formed in the endochondrium. That means inside the hyaline cartilage. So all bones in the body, except some bones of the skull and clavicle, are formed in endochondral ossification. Bones are modeled into hyaline cartilage. Let me clear you before you take the miscalculated judgment in this information. Number one, hyaline cartilage does not change into bone, okay? So what happens in endochondral ossification? First, hyaline cartilage is deteriorated or lost, and then in that place, new bone cell comes and bone cell form and bone is formed, okay? You will see that. So bones are modeled in hyaline cartilage and begins forming late in the second month of embryonic development, so means 8 weeks. Continued forming until early adulthood. So your bone is growing till you are like 25 years old. But after puberty, it slows down a lot. So let's see here, stage in endochondral ossification here. At the beginning, your fetus start developing limbs with these kind of hyaline cartilage. So you have formation of bone collar around hyaline cartilage. So first what happens? Some of the cartilage dies and then bone collar starts, okay? And once the bone collar starts, there is cavitation of the hyaline cartilage within the cartilage model. So this cartilage model is lost, deteriorates. So deteriorating cartilage matrix forms. First they die, and then blood vessels start getting inside, and then invasion of internal cavities by the periosteal bud. So you see periosteal, the blood vessel is entering here, and a spongy bone start forming first, okay? Formation of the medullary cavity as ossification continues, appears of secondary ossification center. So what happens? Around this cavity, slowly new bone cells, and then they start making the compact bone, you see? And to provide nutrition, there is already nutrient artery. So this is, in the center first, there is primary ossification and then cavity formation. After that, in the end, there is secondary ossification start the same way. Cartilage is lost first and then new cells come to form the bone. That's why between the epiphysis and diaphysis, there is the hyaline cartilage is still left, and that is called epiphyseal plate or epiphyseal plate cartilage, or we sometimes call them growth plate. This growth plate is weak. This point is, in young kids, this point is very weak part because they are not joined so properly. In adult bone, this is highly fused and very strong. But in young kids, if they are like teenage, maybe like less than 11 years, any kid, younger the kid, higher the chance that epiphysis will slip from diaphysis. And that is called the growth plate fracture or growth plate displacement. But in the kids, if they slip and then doctor align them again and put in place, it heals so fast. That's why in young kids, fracture healing is very good. Okay. So now, this is the cartilage where you can see there's resting phase of the cartilage, like bone growth phase. So you see, this is the hyaline cartilage. There is epiphyseal growth. There is diaphysis growth. And you can see the deteriorating cartilage is here. And the new bone cells are coming here. You don't need to worry about this much. Okay, so this is the growth of the bone, like the longitudinal length and diameter both is growing. But how we give the smooth shape and certain shape of the bone, that is by bone remodeling, okay? So bone deposit and removal. There are two kinds of bone cells, as you know, osteoblast, the baby bone cells, and osteoclast. So osteoblast deposit bone matrix. Osteoclast eat up the deposited bone matrix. That means remodeling is the function of osteoclast, because osteoclast cells, they are like rough border. Let me draw here so you can see here. They are like, the cells are like here. This is the osteoclast cells, and their surface is very rough border. And then they produce HCl. It's hard to write with this. HCl, produce hydrochloric acid. And this hydrochloric acid produced by this cell eat up excess bony matrix and makes the bone surface and length smooth, okay? It occurs at periosteal and industrial surface. So it slice clear and make it smooth on the surface, inside and out. Okay. So bone remodeling, bone deposition is accomplished by osteoblast, like bone forming, and bone reabsorption is accomplished by osteoclast. And this cell acts under the influence of a hormone called parathyroid hormone from parathyroid gland. Okay. So let's see how remodeling happens by the osteoclast. You see, this is the compact bone, spongy bone. So if there is excess bone, how, you see the osteoclast, this is the cell, there is rough border here. And this rough border is putting acid here, hydrochloric acid, and eating up this bone. So when osteoblasts make it, and if there's access, they are the one who clean it. Okay. Repair of bone fracture. So what is fracture? Fracture is the disunion of the two end of bone. So when you break the bone, that is called fracture. Fracture can be simple or compound fracture. Simple fracture means if you have only one break, that is called simple fracture. And if you have like a bone has several pieces, then we call them compound fracture. And the fracture can be open fracture or closed fracture. Okay. Open fracture means if there is a bone fracture and bone pieces and spikes, it's coming outside the skin, then we call them open fracture. And those fractures are very dangerous. You need hospital admission, hospitalization, because you need IV antibiotics and a lot of care. Okay. So the most common treatment for any fracture is the reduction. So what is the reduction? Reduction means, let's see, here is the bone. So this was the one long bone here. And if it fractured, it becomes two pieces here. Okay. So we have two pieces of the bone, fractured bone. That means they are not aligned here. So what we do, we try to pull them here. So we take the X-ray of this bone. We take the X-ray here. And then under the X-ray, doctor manipulate these two bones and try to bring them closer. And then the closure will not go. That we are reducing the distance, this distance, yes? We are reducing the distance between two fractured ends. And that's why treatment is called treatment by reduction treatment, okay? But if you reduce and you leave it, what happens? Bones will go away again due to the movement of the body. So what doctor do? They align and then they put the plaster. So proximal and distal to the fracture, the joint are not moved. And that way, these bones, new bone cells will come, a new blood vessel will develop and bone heals. And that is called reduction. And there are two kinds of reduction, closed reduction and open reduction. So if fracture is reduced without opening the wound, fracture, then we call them closed reduction. Like if there is a simple fracture, then just we do closed reduction. But sometimes there is a maceration of the bone. And what happens in that case? Like certain section of the bone is in small pieces. That time, if you do closed reduction, you may not align all the pieces together. So what do we do in that case? We open the wound, put all the pieces of bone aligned, and then put sometimes inert steel rod inside, and then put the plaster and give the IV antibiotics for a long time for the treatment. And it takes a long time to heal, okay? So let me raise it again. Okay, so here are some common types of fractures. You see, this is comminuted fracture. You see, there are several. This is the closed fracture, like compound fracture. It's a kind of compound fracture, but there is like several pieces, so we call them comminuted fracture. This is the compression fracture, particularly happens in the, you see the X-ray here, in the old individual where like after menopause, the osteoporotic bone subject to external trauma, and in fall in the old female particularly, this bone is easily crushed, vertebra is crushed. That is called compression fracture. Here is the spiral fracture. You like when your leg is moved and you break the bone like a twig of a leaves. That is called spiral fracture. This is epiphyseal fracture. You see, the growth plate is removed from here. I talked about earlier. It is in young kids a lot. Depressed fracture, particularly in the So somebody hits with the rod, blunted rod on the head, then there is depression of the some area of the skull, and that is called depressed fracture. This is called green stick fracture. Okay. So when you have a fracture and when you bone naturally heals, how it heals? There is several stages of healing: hematoma, fibrocartilage, bony callus, and bony remodeling. So you have bones here. Once you fracture, what do? You have periosteum, and then you have all bleeding here. So you have all artery, the fat, everything. Sometimes you see this contains a lot of fat here. So sometimes bone fracture can lead to death. Do you know how? This adipose fat from here enters these blood vessel, and if they enter into the vein, through the vein, it goes to your lungs, to your heart, from the heart to the lungs, and block the artery and lungs, and can cause embolism, fat embolism, and can cause death. Okay, so first there is hematoma, clotting of the blood, hematoma formation. And when hematoma formation happens, then fibrocartilaginous, connective tissue cells come here, like the mesenchymal cells, fibrocartilage forms, and then slowly the external callus forms from the bone cells, spongy bone, and then bony callus, osteoid-like things start making here. New bone cells are formed, and then excess bone is remodeled and make it smooth. Okay, now some of the disorder of the bones, we're not going to go in detail, but just a definition of the bone. So disorder of the bones: osteoporosis, osteomalacia, rickets, Paget's disease, and osteosarcoma. Osteoporosis is characterized by low bone mass, means mass of the bone is less, because bone reabsorption outpaces bone deposition. So the function of osteoclast is more compared to function of osteoblast. Okay, and that happens in the old female after 55 years of age, because osteoblast works under estrogen hormone. In that age, estrogen hormone is less. That's why osteoblast function is reduced. But bone eating function is higher. Osteomalacia occurs in adults when you have lack of calcium and phosphate, which usually occurs due to deficiency of vitamin D, which absorbs calcium from your GI tract. Rickets is the brother of osteomalacia in the kids, and that is analogous, that's why, to the osteomalacia. So rickets is due to the deficiency of calcium, particularly vitamin D in the kids. Paget's disease is characterized by excessive rate of bone deposition, and this is a kind of tumor-like structure. Osteosarcoma is a form of bone cancer. It is the malignant cancer of the bone, which comes from the bone cells. Osteoporosis, you can see here, this is the normal bone, and you see the abnormal osteoporotic bone. What do you see? Let's compare this area only, or this area only. See the pores in the bone? That is called osteoporosis. Okay, so that is all for this chapter today. Thank you guys, and take care.